Thank you for inviting me to speak. It's a real pleasure to be a part of this conference. This is meant to be an introduction into DMEK. First of all, I would like to acknowledge my mentor, Gerrit Mellis. I learned how to perform DMEK surgery under his guidance at NEOS in Netherlands. And some of the material you see on this talk today, it comes from NEOS and from his sources. This is really an introductory talk, and I will be speaking about what a DMEK is, why you do a DMEK, and lastly, very briefly, how do you perform a DMEK? So, what is DMEK? Well, a DMEK, or Descemet's membrane endothelial keratoplasty, is the most modern form of corneal transplantation for the treatment of endothelial disease, as opposed to a penetrating keratoplasty or a Descemet's stripping endothelial keratoplasty. A DMEK procedure allows the like-for-like replacement of just the diseased Descemet's membrane and the endothelial cell layer. So with a DSEK procedure, you're still transplanting a disc of corneal stroma, but with a DMEK procedure, you're purely transplanting a very reduced volume of tissue. So why do a DMEK? Now, if you examine the patient who has had a DMEK graft on a slit lamp, it's actually quite amazing how normal the cornea looks. From the slit lamp photo in the center and the video of a slit lamp examination on the left-hand side, you will see that it's actually quite difficult to tell that this patient has only had a corneal transplant 1 week before. You virtually can't see the graft. If you do an optical section of the corneal stroma on the slit lamp, you'll see a stromal to stromal interface on the DSEK graft, but you will not see an interface on the DMEK graft. And even if you were to examine the cornea of a patient who has had a DMEK graft under a light microscope or an electron microscope, you'll find that the cornea virtually looks normal. And because we are inducing such a small anatomical change to the cornea, we are not really changing the corneal refraction significantly, and in fact, the small change in refraction comes mainly from the deswelling of the cornea. Now, if we were comparing an endothelial keratoplasty procedure with a penetrating keratoplasty procedure, it will be fairly clear that an endothelial keratoplasty procedure has many advantages over a PK procedure. But if you're comparing a DMEK versus a DSEK procedure, then you'll find that the DMEK has many advantages in being that it alters the anatomy less and it has a higher refractive predictability. Generally, a patient with a DMEK can see 1 to 2 lines better than a patient with a DSEK procedure. DMEK patients have less high-order aberrations, and where patients have had a DMEK procedure in one eye and a DSEK procedure in another eye, patients prefer the vision that they have in their DMEK eye. You can replace a DSEK graft with a DMEK graft and the patient will see better too. If you're looking at the patient's risk for developing corneal graft rejection, within 2 years, then the highest risk comes in the PK group, followed by the DSEK group, followed by the DMEK group, which has the lowest rate of rejection. This is the same information shown in a different way. However, please don't worry that it's going to be quite costly doing a DMEK procedure, because doing a DMEK is cheap. The equipment that you need is simple and very easily obtainable. So going back to our original question of why we should be performing a DMEK procedure instead, well, the simple answer is a DMEK procedure is better. You're restoring the patient's anatomy, the patients see better, they get there more quickly, they have a lower risk of rejection. Doing a DMEK is cheaper, and sometimes it allows you to do more with the same material. So how do you perform DMEK? You could probably separate the DMEK operation into 4 distinct stages. The first stage being to prepare the DMEK donor graft, followed by preparing the patient's cornea and injecting the DMEK graft into the patient's anterior chamber. Then comes unfolding the graft before we fix the graft in place. Now, there are many ways to prepare a donor cornea for a DMEK transplant. This is just one of the ways where you're manually preparing the donor graft for transplantation, and you will see that it does not need a lot of material, and this is easily achievable in any operating theatre. Now, if preparing DMEK tissue for transplantation is too difficult, then a very easy option is really just to order DMEK tissue from an eye bank. Now you have the DMEK tissue, it's time to start the operation. For the procedure, it will be useful for you to get a DMEK set from either DORC or Goiter, which will have most of the instruments you will need. After infusing air into the anterior chamber, you're performing a decimeterexis to remove the patient's diseased Descemet's membrane. You're then staining the DMEK donor tissue with vision blue. You're then injecting the prepared DMEK roll into the patient's anterior chamber. The next stage is where you unfold the DMEK graft in the patient's anterior chamber. This is actually the most difficult step. The DMEK graft tends to roll into a scroll, so what you're trying to do is to unroll the scroll in the patient's anterior chamber. So you're going to need to check that the orientation of the graft is correct. And you're also going to want to use a combination of different techniques in order to unroll the graft in the patient's anterior chamber fairly safely without traumatizing the graft. So you're unrolling the graft without actually physically directly touching the transplant itself. Once the graft is unfolded, you're going to try and fix it in place. You fix the graft by filling the anterior chamber with air for a period of time. After an appropriate period of time, you can remove some air so that the patient doesn't go into pupil block. When the patient goes home, they are advised to posture for about 3 days. So, we have spoken about what a DMEK is, we have spoken about why we should do a DMEK instead, and we have spoken about how you would perform a DMEK. Thank you very much for your attention and time.